All right, good morning, folks, and welcome to the Palliative Care Friday Chalk Talks. Today's topic is on grief in patients with developmental disabilities and how we can help support them. And to do that, we have a fabulous guest today. Arlen Gaines is a longtime hospice social worker who's currently in her doctoral program in palliative care at the University of Maryland. And she's also the director of social services with a hospice in Maryland, where she oversees the social work, chaplaincy, bereavement, and volunteer teams. She is an author of several children's books, including this one here, which is titled, I Have a Question About Death, Clear Answers for All Kids, including children with autism spectrum disorder or other special needs. Our format for today is going to be a presentation, followed by some time at the end for some audience questions. And so with that, Arlen, we are lucky to have you, and I will hand the mic over to you.
Oh, thanks so much, Martin. I've been so looking forward to this palliative care chalk talk. I am a big fan of the format. Short, sweet, a couple little gems to take you on the road. So thank you so much for having me. And thank you all for joining during your busy day today. So today I'm going to share with you a topic I'm very passionate about, which is supporting grieving children and adults with developmental disabilities. And this topic really aligns with the person and family-centered work we do in palliative care and hospice care. So those of you certainly who are clinically facing and patient-centered will invariably be working with families who perhaps have a child or an adult with a developmental disability. So I'm hoping that this topic will have some applicability for you in your practice. So at the conclusion of our brief time together this morning, I'm hopeful that you'll be able to describe two different models of disability, which I'll talk about, and explain the impact of disenfranchised grief and secondary losses, which are two really interesting topics as impacting people with developmental disabilities, and we'll hopefully be able to have you feel comfortable discussing some examples of some inclusive grief support strategies. So I wanted to start with some general terminology to just help frame our discussion this morning. So we often see the term developmental disabilities. Well, what does that mean? That is a broad umbrella term, and it includes a range of developmentally related conditions. And so these typically begin before the age of 22 and last throughout someone's life. And you can see some examples of developmental disabilities on your screen. There are many more, and they can actually often co-occur. But overall, they impact areas such as social and emotional development, and language and learning, physical functioning or behavior. And at this point, about 1 in 6 children in the US have a developmental disability. One type of developmental disability we often hear about is intellectual disability. So this is a disability that impacts intellectual and adaptive functioning. So intellectual functioning has to do with that ability to learn or to reason or to problem solve. And adaptive functioning has to do with those everyday social and life skills that can often be really complex. About 1 to 2% of individuals in the US have intellectual disabilities, and they really often co-occur with physical health issues. So even though this is not a high percentage of individuals, they're often experiencing very high levels of healthcare utilization due to many of the concurrent medical needs or maybe some of the supportive services. This population, I really can't underscore the long-standing historical marginalization people with intellectual disabilities have experienced. It's mind-boggling to think that as late as even 1960, some people were being involuntarily sterilized, and many, many individuals were sent away to institutions. So you may be working with a family, maybe an older adult, and they have memories of having a sibling who was sent away. You may hear some of those stories. We also often see the term IDD, and that is intellectual and developmental disabilities. This is a word that really just acknowledges that very significant and common overlapping between intellectual and developmental disabilities. So again, many individuals with intellectual disabilities are often having other types of issues they're working through, including maybe seizures or hearing impairment, maybe speech and language issues. When we think about disability in general, there are two main models. So the traditional medical model is certainly even where my own education sort of stemmed from. My training was in the medical model, I'm sure for many of you too. This has to do with learning the DSM and learning about all the conditions and the various disorders and all the deficits. You can hear these words and terms associated with various conditions. We've learned maybe about symptoms, about etiology, about treatment, and the impairment of the disability. For example, you'll hear about autism spectrum disorder, and that is something that really falls under the medical model. But in more recent years, really driven by autistic self-advocates, there has been a real emerging model of a neurodivergent affirming social model. And this is really, really important for our field to know, especially those of us who are in clinical practice. This has to do with disability really being an intrinsic part of one's identity. So instead of a disability being something to cure or something to treat, it really focuses on differences rather than deficits. And really has to do with looking at the environment, looking at society, and removing barriers. So really consistent with this model is being so sensitive to how individuals with developmental disabilities define themselves. Last weekend, I was at a wonderful art show at the Bender JCC in Rockville, Maryland, right close to where I live. And there's this art show of paintings and tapestries by disabled artists. And this tapestry in the middle just really spoke to me. And I knew I was doing this presentation, so I snapped a photo. I define who I am. And this is really about the neurodivergent affirming social model of disability. So people may really prefer to kind of own their identity and define themselves. For instance, someone may define themselves as an autistic person rather than a person with autism. They may define themselves as neurodivergent. So you may hear some of these different terms, and you can ask people, how they identify. And we can be very sensitive to that in our practice. So all that being said, when we start to think about individuals with developmental disabilities and grief, there are a lot of things to keep in mind so we can be really sensitive and inclusive in our support and in our practices as we work with these families. So people with different developmental disabilities have a number of social and developmental considerations that really might impact their grieving process. For instance, some individuals have some differences related to navigating social communication. So there may be individuals who may communicate non-verbally. Maybe they have expressive or receptive language delays. Maybe there are some differences in making friends or keeping friends. Maybe the support system is maybe more limited. Sometimes people have a lot of reliance on the social support of a trusted adult. So we're starting to think ahead. If that trusted adult dies, there may be some real challenges there. Some individuals really process information very concretely or visually. So for instance, once I was supporting a family who had an autistic son. He was about 8 years old, and they were supporting him around the approaching death of his grandmother. And he really processed information very concretely, and he was very mathematically inclined. So they explained her death to him kind of in terms of mathematical concepts. They would say grandma is closer to dying. Her body is at about 20%. And as she got closer to dying, they said grandma is really close to dying. Her body is stopping working. She's at about 5%. And when she died, he said, I understand her body's at 0%. And that was how he could process information. And finally, a lot of individuals with developmental disabilities have some, if you could mute, please, that would be great. Thanks. Have some differences related to navigating new situations. So changes in routine can be really disruptive. And my goodness, when someone in a family is dying or has died, that can be a huge change in routine. So a lot of these differences can really impact how people conceptually understand death. Sometimes there are behavioral changes that result, and sometimes those can be attributed to the disability rather than grief, which is called diagnostic overshadowing. Actually, a plug for my colleague, Caitlin Moore, who did a great palliative care chalk talk, and she talked a lot about diagnostic overshadowing. So all of these issues can really impact one's grieving process. Just very briefly, the state of the research related to how people with developmental disabilities experience grief and bereavement has been traditionally very, very limited. But thank goodness, over about the past 30 years, it's been slowly emerging. So going back to that long-standing historic marginalization, you can imagine that people with certainly intellectual disabilities were considered unable to grieve. These are not people who have the capacity to grieve. And starting about 30 years ago, some early research started to develop showing, well, that's not the case. This is a myth. People really can experience grief and loss. And the literature has been slowly progressing, mostly related to adults with intellectual disabilities. There's some literature on early measurement tools, some literature exploring prolonged and complicated grief. There's some new research looking at provision of palliative care for adults with intellectual disabilities. But the literature related to grieving children with developmental disabilities is still very, very scarce. And that's actually my particular research interest area. Despite this limited literature, it really coalesces into this idea that disability does not shield a person from grief. So I wanted to share just two little gems kind of pulled from the literature, and also I'd say from my own clinical practice, certainly over the years, related to how people with disabilities may experience grief. So the first little area I wanted to share is about what's called disenfranchised grief. So this is a really amazing, important concept. For those of you who haven't heard of this, Dr. Ken Doka has a really important and foundational book to our field called Disenfranchised Grief, and you can certainly check that out. There are a lot of different typologies, but overall, this has to do with grief that is not socially sanctioned or openly acknowledged. And this is really what happens a lot for people with developmental disabilities, that we're just not really acknowledging the grief they might be experiencing. So what happens, and I have seen this so much over the years and really supported families around this, is that people, children, adults with different developmental disabilities are often seen as unable to grieve for a lot of different reasons, again, due to much of the marginalization they've experienced. And so because of that, they are often not told the truth about the death. This can be very well intentioned. Of course, we want to protect people. We don't want them to feel sad. Maybe we don't have the tools to tell them about the death. Maybe we don't know how to talk about this subject. This is the hardest subject to talk about, especially with children. So even though this may be very well intentioned, because people are not told the truth about the death, they are, of course, excluded in lots of different ways, maybe from funerals, from memorial services, from just the death education kind of about what happened. And this can really impact opportunities to process the loss, and can certainly place people at risk for prolonged or complicated grief. And that's where some of the research is right now. So those of us in palliative care and hospice, as you're working with families and there's someone in the family with a developmental disability, no matter what your discipline, we can encourage some of these conversations, really thinking about how can we include this person in this experience, and thinking about what ways can they be there. So if someone can't come to a funeral, if that doesn't work for that particular person, are there other rituals they can be part of? Really talking about the person who died, using concrete language, and having some really thoughtful preparation about how they can be included. For instance, if someone comes to a funeral or a memorial service. So lots of different ways to address thoughtful preparation. I thought I'd just give you one little example. I have lots of more, but in the spirit of our short little palliative care chalk talk, I just put one thing. So this is an example of a social story. So social stories are used often in special education to help explain different social situations. It's a really helpful tool where there are less words and images. So this would be an example. I just kind of pulled this together of a social story to support an individual going to a memorial service. So we might talk in advance about, we're going to get dressed in the morning. We're going to go to this memorial service. There will be a lot of people. but I can take a break and then we will go home. And that can be really reassuring to know what to expect, to have a plan in place, to have a trusted adult on hand, and to help them know they can take a break. So the second little gem I want to leave you with today has to do with secondary losses, which really have to do with the losses that occur as the result of the death. We see this in grief work all the time. So there is this often a real sadness or lots of different feelings about the loss of the person who died, but all the related losses are sometimes what really impact people after a death. For instance, there are many secondary losses that might impact grieving people with developmental disabilities. So you can see the person who died in the middle. If someone has died, there may be a really significant loss in routine. And this is critical because routine and structure brings so much comfort, brings structure and comfort to all of us. I know I have my routines in the morning that bring comfort to me. And if my routine is disrupted this morning, we're in Maryland, we have a couple inches of snow. This is a big event for us in Maryland. And so everything is closed and my routine has been disrupted this morning. My day was a little off today. Although I was excited I was going to see all of you. So for instance, for people with developmental disabilities, there may be a loss of, for instance, Friday dinners. We hear this a lot, that there have been sort of weekly family rituals. If that person has died, that might change. For children, there might be a loss of who picks them up from school. So really thinking through these losses of routine and structure. There's sometimes the social loss that happens when someone has died. So again, if the person who's died was that reliable, unconditional social role for the person, the adult or child, that is a tremendous loss and can really have great impact. The other thing that comes up, and this is in the literature, really has to do with the loss of the keeper of the person's story. So as I shared at the beginning, some of the individuals we work with have very complex medical, social needs, and the person who died, if they've been that point person and kind of the keeper of their story and their history, there can really be a loss of continuity of care. And that is a really difficult situation. And finally, sometimes people need to move or have lost their home. We see this certainly in hospice work. We have a patient who died. That was the loss of a second parent, and there's been an adult with an intellectual disability, maybe who's been living with that parent. They are in a position where they have to figure out where they're going to live and who's going to maybe help care for them. There are lots of things we can do to attend to secondary losses. A couple little examples here. So for instance, if we know someone in a family is going to be experiencing social loss, we can think in advance. And as clinicians, we can work with this family. How can we think about bolstering your support system now? Who is in your support system? If they're going to need to move, how can we create normalcy and structure and routine amidst all these different changes? And if it's the loss of the keeper of their story, who is going to step in? Who can provide that continuity of care? In general, this is where my social work training comes through. I always like to take a strengths-based approach to the work I do when I support all families, and particularly families who are grieving and there's an adult or child with a developmental disability in that family. I turn to that family because they are the experts, and I would like to find out, how have you navigated other challenging situations? What worked for you? What was comforting? Was it helpful to have sensory-based supports? Was it helpful to have a quiet space? So really tapping into that expertise and hearing about what has worked before. And goes without saying to really think about the cultural and belief systems, spiritual support system, and think about how that might factor into coping and sources of support. So as I wrap up, I just want to kind of close with sharing that supporting individuals with developmental disabilities in their grief means knowing disability does not shield a person from grief. If there's anything you take away from today, I think it would be this line here. Thinking about finding developmentally appropriate interventions, working with the family system, working with the person, hearing what has worked in the past, and supporting them as they're navigating this time. and honoring this unique grieving process of all people so they're not feeling disenfranchised in their grief. I have a couple resources on my slides, and I'm happy if Martin shares the link if this is of interest. Not a lot of literature in this area. There's this book I have written in partnership with a special educator. I have a question about death. I have a question about cancer, and some other books too. There are a couple of workbooks, a couple of resources for adults. Again, not a lot. There are a couple related online resources you're welcome to check out. And I have lots and lots of resources and references if you ever want to kind of go into the literature and do some reading there. And here's my contact information. And always love when people contact me. This is my favorite topic. I'm doing my doctoral work in this area. So please get in touch at any point if I can be helpful or supportive, or you just want to talk more about this topic or maybe collaborate in some way. So thank you. Maybe should I stop sharing, Martin? And
yeah, that'd be perfect.
Okay, great.
We'll open it up for questions. I see that Tom has got one. Let me ask you a quick one, and then we'll see if after my question, Tom might be willing to unmute and ask his, and we'll take it from there. So
wonderful.
I have heard the term people of different abilities instead of people with disabilities. It kind of gets at the language you were talking about at the beginning. Is this a term that is becoming more prevalent? What's your thought on that? I know very little about this.
It's a great question. There are so many different and passionate viewpoints on lots of different terms. So I would never want to speak for a whole community of people with and without different developmental disabilities. Some people find that a very empowering term, but sometimes people find that an insulting term because they feel like they're happy to own their disability. And again, it's an intrinsic part of their identity. So again, I would turn to people we're working with and to really hear from them about what's important to them. Great question.
Tom oh, perfect. Thank you.
Greetings, everyone. Great presentation. I'm very appreciative. Secondary loss is something that I need to reflect on. I have at least one question, and one of them is with older adults. Of course, you spoke about younger population. We have the Erik Erikson kind of model, and it kind of say a guidance about where someone's supposed to be and how they're reacting and everything. But I never really thought of grief. The question is with the abilities that we spoke of, is there a thought that there should be a different way of thinking of developmental stages, or that concept doesn't apply?
I can't tell you how much I appreciate that question, as I love grief models and grief theories, and it's a big part of actually my own doctoral work. It's a really, really interesting question because many of the ways that many of us have learned about grief and how to conceptualize grief and some of the models related to grief have not been kind of tested with very diverse populations, including people with different disabilities. So for instance, we have a model that we often use in our grief work called continuing bonds. And it really has to do with the fact that when someone dies, we don't break bonds, that we really have this evolving, ongoing connection to the deceased and to the person who died. But I wonder, for people with developmental disabilities, many of whom may process information more concretely, do some of these models hold up? So I'm definitely exploring some of that actually in my own research. But typically we will really look at, instead of age, we will look at sort of developmental understanding and really think about how we can adapt our support to different people and kind of where they're at in their understanding. And there's a lot, we don't have a lot of time, but I'd be happy to talk more offline about that topic because I love it.
I have the privilege to ask a second question, and it has to do with spirituality and sexuality within the disabilities. How does that affect the grief or the models that you have, that you use?
Great question. Not real. I would like to say not a lot in the literature, because I can't even think of what's in the literature related to that. It is so limited. So we have a lot of work to be done. really thinking about even sexuality in our adult population, our seriously ill and hospice population, that is already a sort of limited area. I don't think I can confidently speak to sort of evidence-based kind of what's in the literature on that, because I just have not seen a lot. But that being said, we really want to honor the whole person and really think about all aspects of their personhood. And so thinking about all these, I appreciate that question, Tom, because it's something we want to think about when we're supporting our patients. Great questions.
All right, Arlen, we're just about at time. We really appreciate you. That was a fabulous presentation, wonderful information today.
Thank you so much, Martin. Thanks, everyone. Have a great day.